Thank you, Margot, and thanks for the chance to be here. For those who were present when I was talking yesterday, I apologize for being inflicted on you twice. Much of what I will say will overlap with what I said yesterday because the world of sport and exercise nutrition has not changed in the last 24 hours, but I'll try to make it a little bit more practical, as Margot suggested. And I said yesterday, most people, when they talk about a subject, try to tell the audience it's the most important thing there is in the world because it's their pet subject. But if we think about performance in any sport, it's about talent. The talented athlete should always win. But the talented athlete needs motivation, needs to do the training, needs to respond to the training with an improvement in performance, needs to avoid injury or recover from injury. And if you've got those things all in place, then you start to think about the little things that start to make a difference. And nutrition is one of those little things you can see on the screen. And can you see what it says underneath nutrition? It says supplements. I made the font too big. I should have made it smaller because I've ranked these things in the order I think they're important. Next time I'll make that font a little bit smaller. So nutrition is a small part. But if all the other guys on the blocks have the same talent you have, if they're motivated to win, if they've trained hard, if they're in that position to win, then we're looking for the little things that will give you the edge. And we have to recognize that there are some things we can change and some things we can't change. We have a limited pool of talented athletes. Some countries are fortunate, they've got a large population, they've got great facilities, they've got a lot of people to choose from. Many countries, particularly the smaller countries, really have to develop that genetic potential. They don't have a large pool, and they need to work on developing it to its maximum by looking at all the things that make a difference. A couple of years ago, we had a conference at the IOC, a small expert workshop, and the conclusion of that conference was that diet significantly influences athletic performance. That's a very clear and unambiguous statement. What you eat will affect how you perform. But it qualified that by saying an adequate diet. Well, what do we mean by an adequate diet? In terms of quantity, so how much food, and quality, what kinds of food, in training and in competition. So a lot of questions begin to arise, but very clearly saying diet affects performance. On the other hand, if we speak to people in the world of elite sport, some of you might recognize this well-known football coach from the UK. He said, if you can't pass a football, a plate of pasta is not going to make much difference to the result. And he's absolutely right. A plate of pasta is a small part of the big picture, the big things, talent, training, motivation, coaching, all those other things. And if you look back at the history of sport and exercise nutrition, I go back to some of the older publications. This was written when David Gerard was still quite young, published in 1888. And it's about athletics and football, but it covers the whole range of sports medicine and exercise science as it was at the time. And it says in relation to nutrition, the ideal diet for a man in active training is that which would be best for a healthy man who's obliged to take a very large amount of active exercise. I.e., the diet is not radically different for the athlete. You're just dealing with somebody who works hard. But then there was a very insightful comment. What that diet is a matter for scientists to decide or to differ upon, as they usually do in such matters. So controversies in the area of nutrition are not new. They've been around as long as sports nutrition has been around, and we still have many controversies today that greatly muddy the water. The old idea on diet, and by old I mean up until comparatively recently, maybe 20 or 25 years ago, was we were trying to help athletes to train harder by promoting recovery between training sessions. And if we can get them to recover faster, they can train harder with a reduced risk of injury and illness. And if they train harder, they'll improve to a greater extent. So the focus really was on recovery nutrition. What we say now is, it's not so much about training harder, it's more about training smarter. If we can get the same performance improvement with less training, then we reduce the risk of illness, injury, staleness, and all those other factors. So we're trying to maximize that adaptation to the training stimulus. And we now say if we're going to give nutrition advice to an athlete, it must be evidence-based. We want to see that evidence. It's no longer enough to say, I think, or I believe, or someone told me. Where's the evidence for making statements and making recommendations? It needs to deal with athletes as individuals. Prescribing nutrition programs for teams is not the way we should go forward. We should be monitoring the response of our athletes to any nutrition intervention by looking at relevant biomarkers. And a nutrition program should be provided by a qualified nutrition professional working as part of an integrated support team. Even today, in many professional football clubs in the UK, the responsibility for nutrition lies with the physiotherapist. I say to the manager, if you have a player with a broken leg who's recovering, you don't send them to a dietitian. But you've got a player with a broken diet and you send them to a physiotherapist. It makes no sense. And again, from the world of football, I spoke at a conference in Norway a few years ago, and the coach of the very successful Norwegian women's football team said normal training gives normal results. And I think every coach understands you need to do something a little bit different. If you just copy what everybody else is doing, they'll still beat you because you're always one stage behind. And by the same token, when I spoke the next day, I said normal diet gives normal results. We need to be a little bit smarter than the opposition and do something better. Now, there are two things we need to think about. We need to think about the everyday eating. And we mostly eat several times a day, and every time we make a choice, that choice we make influences our long-term health, our long-term functioning. But we don't really think very closely about it. But every food item potentially has a long-term consequence. And we can make choices so our diet looks like this, which if you eat in the coffee break and the tea break, your diet would look something like this. Or you could make radically different choices. And I notice Margot doesn't eat in the coffee breaks because Margot's diet is much more sensible than that of many of us. And when we think about nutrition, we have to think about everyday eating. What are we doing day in, day out to support that training? And then, on the big day, what are we doing in the last week, in the last days, in the last hours? What are we doing between sessions? And we think how the training load varies across the season and varies from day to day. The diet must vary accordingly. We don't simply see the athlete once and say, this is what you're going to do for the next 6 months. So we think about the balance between training and competition needs. And we think too about translating nutrition goals. We identify how much a player needs, an athlete needs, a swimmer needs, in terms of nutrients, how much carbohydrate, how much protein, how much vitamin C. But we then have to translate that into food. What should you eat and when should you eat to get those nutrition goals addressed? And we recognize you can make many, many different food choices to get the same nutrition intake. And we can summarize our nutrition goals, and this is perhaps the most important slide of all that I'll show. We're trying to optimize body mass and body composition, and nutrition in combination with training will build the physique that you want your athlete to have. We're trying to restore exercise capacity before the next training session or the next round of a competition. We're trying to maximize the effectiveness of the adaptation to each single training session. And we're trying to minimize muscle damage and soreness and illness and chronic fatigue. And when it comes to competition, we're trying to maximize performance. And nutrition has a role to play in all of these things. It makes no sense to train hard and ignore the benefits that nutrition can bring. So we begin by assessing status of our athlete. Is the current situation, the nutritional state, good, or is it not good? We should look at status, which doesn't mean simply monitoring what they're consuming. We should use objective biomarkers to assess iron status. Measuring someone's iron intake, for example, tells you relatively little. It tells you nothing about whether they're deficient or replete. Measuring their iron status tells you whether you need to change their iron intake. You assess their current eating habits and you assess their current dietary intake, looking for patterns of nutrient intake to see where improvements might be made. You monitor physique and body composition. And you speak to the medical team and you speak to the coaching staff and say, is this athlete performing as they should? Are they improving as they should? Are they healthy? Are they fit? We think about energy. The demand varies hugely from day to day, varies hugely between individuals. Big people need more energy than small people. The training load has a huge impact on energy needs. Young people who are still growing need small amounts of extra energy for growth. Everybody's different. We can't simply prescribe an energy intake. And sometimes we need to be careful when we're manipulating physique. We're encouraging muscle growth. We're encouraging fat loss. And that means manipulating the energy balance. We talked about this morning, and Margot talked about it in the red session, about energy availability and energy balance. It's difficult to prescribe intake, but we can easily measure body mass, and we can relatively easily measure body fatness. If you can pinch an inch, as I can, you've eaten too much. If your weight is falling, your energy intake is less than your energy expenditure. If that's not an intended outcome, you need to address the energy intake or the energy expenditure. So simple, individual-based prescriptions. Of course, when we exercise, the muscle needs fuel to do work, and the primary fuel during high-intensity exercise is carbohydrate, stored as glycogen. We use fat when we exercise at low intensities, but we rely on carbohydrate at high intensities. After exercise, we have to replace that carbohydrate, or we cannot repeat high-intensity sessions. And often when a player, an athlete, a swimmer, a cyclist complains of fatigue, we can identify a relatively low carbohydrate intake between training sessions as one of the causes. So we need to eat food that contains carbohydrate, and we need to look at how much carbohydrate we get from that food. We need to look at when we eat it. We need to look at the different types of foods that are going to contribute. And we think about the other nutrients that are present. We can choose carbohydrate-containing foods that are high in fat or low in fat, high in protein or low in protein, foods that will give us vitamins and minerals, or foods that will give us none of these essential nutrients. And we shouldn't think of carbohydrate as a percentage of intake, but as an absolute need. How many grams of carbohydrate do I need to recover from today's training session? And if I'm doing an easy day, I maybe only need 3 grams per kilogram of body weight. If I'm doing a hard training day, I might need 10 or even 12 grams per kilogram of body weight. And that's a big difference in the foods you have to choose and the amounts of food you have to choose to meet those goals. So we need flexibility in intake. Recovery, of course, is crucial. It should be periodized according to the athlete's needs, and it should be individualized. But there's lots of other things that have to be done in the recovery time as well, not just eating, and we need to work all of these things together to make an integrated strategy. And you'll often read, you must eat protein within 20 minutes after exercise, or you have to start carbohydrate intake immediately after exercise. Well, there's a bit of flexibility in those windows. They're perhaps not quite as rigid as you might think they are. And always remember, something is better than nothing in most situations, but we're trying to optimize the outcomes. Thinking about training, what we're trying to do with training is to improve performance. So we apply a stimulus, which is the training stimulus, and we produce an adaptation in the body's tissues, primarily in the muscle, but also in the heart, the lungs, every other organ of the body. And this is what we do as scientists, and again, I apologize to those who saw this yesterday. This is the sort of result we see from a strength training program. We measure muscle strength, and it increases progressively. Our program's working, but it's highly specific. It's not improving endurance. So we're producing changes in the muscle. We're breaking down proteins we don't want. We're making more of the proteins we do want. And that process occurs not during the training session, but in the hours and the first day or two after each training session. And what we have to try and do is to maximize the effectiveness of that. If we train harder, we get a bigger stimulus, but let's not just go for harder. Let's put in the same stimulus and try and get a bigger adaptation. And just to show you how effective it is, you can see the difference between the strength training program, which this athlete did with one leg, and the endurance training program they did with the other leg. A highly selective synthesis of specific proteins. How much protein? Well, the IOC consensus conference said you should take about 20 grams, perhaps a little more, soon after exercise, and that's going to maximize the response. Dairy proteins are more effective than other types of protein because they contain leucine, which is an essential amino acid. And the timing seems to be relatively important, and eating that protein soon after training is likely to be best. So when we come to promote the recovery and promote those adaptations, we have to start soon after training. What do? Do we go for a fancy commercial protein carbohydrate shake that the athlete can consume? It has some advantages. It's convenient. It's easily available. But we could also go for a sandwich and a glass of milk. It's going to give us the protein needs. It's going to give us the carbohydrate. And it's also going to give us some vitamins and minerals and other bits and pieces. And it's cheap, inexpensive, and it's probably safe. At the FINA Nutrition Conference that was held in London just about 3 years ago now, we addressed a whole raft of other issues. And I think in your conference bag you have the booklet that was one of the outputs from that conference, and I'd strongly encourage you to read that to get some detail on all these different issues. Micronutrients attract a lot of attention. By and large, if you're training hard, you eat a lot of food. If you eat a lot of food, you get a lot of vitamins and minerals. But not every athlete is training hard all the time. And not every athlete makes good food choices. The more you restrict a diet, whether it's a vegetarian diet or a vegan diet or a I don't eat anything green diet, the more you restrict it, the less likely you are to meet your micronutrient needs. But generally speaking, you can get everything you need from food. There are a few supplements that may be useful in some situations, but out of the many thousands of supplements on the market, there's a handful that might benefit some swimmers, some athletes in some situations, but no more than a handful. A couple of simple rules of dietary supplements: if it works, it's probably banned, and if it's not banned, then it probably doesn't work. But there may be some exceptions, but those exceptions are very, very few. If we are going to use supplements, we need a risk management strategy in place, because supplements can cause adverse health outcomes. At worst, they can kill people, and they can cause athletes something worse than death. They can cause a failed doping test. And this is well established. Some supplements, without saying it on the label, contain prohibited substances that will cause a doping test. And athletes have lost their careers through the use of dietary supplements. So we need a strategy in place. We should use them only if there's a likely benefit. We should use them only in doses that are safe, and we should be careful about selecting low-risk products. How do you assess the risk? You speak to somebody who understands the issues. It's not as simple as it might seem. What about competition nutrition? Forget about a balanced diet. Performance is the sole focus. You're not competing every day of the year. On those days, you can afford to be relaxed about meeting your recommended intakes. You can do that all the other days. You need to manage the energy reduction that comes when you're tapering your training load. And if you've got a heavy program with many events on multiple times a day, then a recovery strategy is absolutely crucial. And key in that is consuming sufficient carbohydrate to maintain those muscle glycogen levels. And on competition day, you might want to consider some specific targeted supplement use. But if you do, it should be done very carefully, and it should have been practiced in training or at minor competitions. So in summary, we need good food choices to support consistent intensive training and at the same time to promote adaptations taking place in the muscle. But the diet must be individualized. We cannot have a team prescription that suits every individual. And we need to look not just at what the science tells us, but we need to use our own experience, our own knowledge of the wider issues, and we need to speak to the relevant experts, the physician, the coach, all of the support staff who can help us understand the athlete's situation. There are some simple principles. We need to get the right amount of energy. We need sufficient macronutrients, particularly protein and carbohydrate. We need to get those essential micronutrients, the vitamins and minerals, and just maybe a few supplements if they're carefully managed. But what it does mean is we do need a qualified sport nutrition professional rather than relying on someone who's got the sport nutrition knowledge from a Sunday supplement. So I'll stop there and thank you very much.
Thank you very much, Ron. I'm so glad you didn't see me having the donut at the break. Questions for Ron? Any questions for Ron? It's a very bright light there, isn't it? Yes? Do we have a microphone? Yeah.
Sorry, Ron, can you just talk about the protein intake at night before bed?
That's something that's attracted quite a lot of attention in recent years, and it's something I would have included had time allowed, because it does seem to be important. We know that after the intake of a protein-containing meal, there's a stimulation of protein synthesis and a suppression of protein breakdown that lasts a few hours. And clearly, for many of us, we go to bed at night and we don't eat till morning. We have an absence of food for 12 hours. During that period, we're not maximizing the adaptations that could take place in the muscle. Because what happens when you increase protein synthesis, you use up the available pool of essential amino acids. If you don't replace that from the diet, you restrict that protein synthetic process. So there's been some evidence that eating late at night, or even getting up in the middle of the night to consume a small protein snack, and then going back to bed, may be beneficial. The evidence is not entirely convincing, because much of it comes from short-term measurements of protein synthesis. And of course, you don't win a gold medal because you've got the right protein synthetic pathway. You win a gold medal because you perform better. So we need some longer-term outcome measures, but the short-term data do likely seem to translate into a longer-term outcome. Now, in some ways, this is just science catching up with reality, because 30 or 40 years ago, when I first started working in this area, I spoke to some bodybuilders, and they said we get up every 2 hours during the night to take a protein shot. Every 2 hours, these guys were getting up during the night. Now, I don't think we need to go to that extreme, but we might want to think about protein before bed.
Thank you. I have one question before you run away. I do see a fair amount of iron deficiency in endurance athletes, and you weren't, I'm sure, time-wise able to address timing of that, specifically in relation to hepcidin release from the liver with inflammation training.
I would never run away from you, Margot. I think you're right. We do see a fairly high incidence in endurance athletes, particularly in runners, and it's partly related to food strike hemolysis. Your feet hit the ground, you rupture some red cells, and you lose some iron. But it's also partly, at least, related, I think, to the fact that many endurance athletes adopt a vegetarian or a close to vegetarian lifestyle. And in some cases, they do that without thinking about the reasons why they're doing it. And therefore, they don't think about the dietary changes that they need to make. So I think we need to work with the athlete, if they are iron deficient, to understand why they're iron deficient and to look at what we need to do to correct it. But I would say that the available evidence, at least in the UK, says we have more athletes with iron overload toxicity than we have with iron deficiency anemia, because there's a common feeling that because there's a risk of iron deficiency, and because iron deficiency hurts performance, you take an iron supplement just in case. Well, what you do, you get a simple blood test, and you get your hemoglobin measured, and you get your ferritin measured. And if you're iron deplete, you don't need a supplement. If you're iron depleted, you do need a supplement. Now, some years ago, I spoke with one of our most successful female distance runners, and she was taking iron tablets. And I said, why? She said, just in case. I said, well, let's get a blood test done and see. She says, oh, I've had a blood test done. What did it say? It said everything's fine. So why are you taking iron tablets? Just in case. It's not logical, and it's not sensible. There is no just in case if you've had the necessary investigations. Don't do it.
Super. Thank you very much, Ron.